Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, I hope you are always healthy. My name is Sintia Imanida Pratama. I'm from Class 2B of nursing student at Poltekkes Tasikmalaya. In this video, I will presentation about a nursing journal by title The Effect Benson Relaxation Technique with Anxiety in Hemodialysis Patients in Yogyakarta, with the author Anissa Nuri Kurniasari, Anita Kustanti, from Nursing Science Faculty of Medicine, University of Gadjah Mada, and Harmila from Poltekkes Yogyakarta. The incidence of kidney failure in the world is quite high, with an estimate 8–16% of the total world population according to JIT al 2013. More than 25 million people in Indonesia had decreased kidney function by February 2012. During the period of August 2014, 319 patients were on regular hemodialysis in the hemodialysis unit of PKU Muhammadiyah Hospital in Yogyakarta. Patients on long-term hemodialysis treatment have several problems such as finances, unemployment, loss of sex drive, depression, and fear death deficient treatment, RAP 2005. Research in Indonesia found that the anxiety rate in hemodialysis patients was 77.8%, 42 of 54 respondents with various levels of anxiety by Luana et al. 2012. If left untreated, anxiety can lead to worsening of the patient's health condition. The importance of the research is that Benson relaxation technique involves the patient's confidence factor, focusing on certain words or sentences that are repeated at a regular rhythm, with expectation that anxiety reduction in hemodialysis patients will occur with this technique. And this is one non-pharmacological technique that can be used to reduce anxiety is relaxation technique. Relaxation technique can effectively decrease and prevent the psychological effect of stress. Jones 2009. The purpose of research on Benson relaxation technique to reduce anxiety in hemodialysis patients is still rarely practiced in Indonesia. Based on this, the authors use the Benson relaxation technique to reduce anxiety. This research using quasi-experiment, pre-test, and post-test design with comparison group and quantitative research. Observations are conducted twice before and after the intervention in the intervention group, and before and after in the comparison group without intervention. The draw is based on the time of hemodialysis, namely morning and evening. Sweep text is done by making two papers with morning and afternoon written on them. Then each is folded and shuffled. The draw is done being folded. The paper drawn first is considered the intervention group. This research is conducted in the hemodialysis unit PKU Muhammadiyah Hospital in Yogyakarta in January 2015. 4 subjects responded in the study were patients who underwent hemodialysis in PKU Muhammadiyah Hospital and suitable with the inclusion criteria, a population 319 people. The researchers used the Analog Anxiety Scale or AAS questionnaire to measure respondent anxiety. Overview of demographic characteristics of the respondent fully presented in Table 1 beside. Respondents were divided into two groups, the intervention group and the comparison group. The group division is based on the results of the lottery withdrawal. The intervention group consisted of patients having morning hemodialysis at 7 o'clock to 12 o'clock, and the comparison group consisted of patients who did hemodialysis during the day at 12 o'clock to 15 o'clock. Prior to the implementation of the research, the researchers collected the respondent data based on multiple variables such as gender, age, education, marital status, and duration of hemodialysis. Data in Table 1 for the variable gender is P equal 0.296, age P equals 0.121, the latest education. P equals 0.599, marital status. P equal 0.071, and duration of hemodialysis. P equals 0.510. As we can see, it shows that the demographic characteristics of the intervention and the comparison group are the same. The results can be seen in detail in the table 2 beside. Preview of the anxiety value of pre-test and post-test relaxation during Benson relaxation technique to intervention and comparison group. Analyzing the average and deviation standard as well as minimum and maximum values on the value of anxiety. Based on data showed that the average value of anxiety in the intervention group was 21.93, while in the comparison group the average value of anxiety was 17.19. From this data, the pre-test value in both groups have the same average anxiety category in the range of value 15 under 27 or moderate and serious category. Based on the results, the conclusion that Benson relaxation technique does not affect the decrease of anxiety value on hemodialysis patients in PKU Muhammadiyah Hospital in Yogyakarta. In this study are different from another study regarding the provision of Benson relaxation technique performed by Mahdapi et al. 2013. He stated that there was a significant decline in anxiety value in the intervention group and none in the comparison group. This shows the Benson relaxation technique is able to reduce the level of anxiety, whereas none was found in this study. Difference of results of this research with the research conducted by Mahdapi et al. 2013 might happen due to difference in the number and characteristics of respondents, place of the study, and time of intervention. Research conclusions in this journal are: 1. The pre-test anxiety value in both groups was in the middle category, with an average value of anxiety 21 points 9013 in the intervention group and by 17.19 in the control group. 2. The post-test anxiety value in both groups experienced a like decline, with average anxiety value of 13.57 in the intervention group and by 12.94 in the control group. 3. The difference of average between the anxiety value before and after getting Benson relaxation technique in both groups experienced a significant decline, with P equals 0.001 in the intervention group and P equals 0.014 in the control group. Okay, maybe that's all I can present. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.